From a son who cares for his own aging parents, with programs like these, my parents are at lower risk when they go through hospitalizations. Hopefully that means they're going to have fewer complications and the burden on the family then is lessened. The Geriatric Surgery Program is designed for patients of all different types of surgical disciplines. It benefits those patients by taking a big step toward risk screening and coordinating care that we can individualize to the patient's needs. Designed for all members of the community in their older years, 75 and above, who are staying in the hospital and anticipated to stay in the hospital for more than one night. We ask very specific questions that are designed to get at the specific risks of the geriatric population. Things such as their nutritional risks, their ability to take care of themselves and perform their own activities of daily living, their ability to perform their independent activities of daily living, their ability to remember and think critically through problems, so that we can define what their specific risks related to surgery and anesthesia are, and then care plan for them. One of the best parts of this program is that you don't necessarily realize that it's happening. When you go to your surgeon's office, there'll be questions that maybe you would not have encountered before around your personal goals of care. Why did you come to the office? What is that you're looking to achieve? When you go into your pre-admission testing office appointment, you'll have extra questions asked of you to look for your frailties. Some of those questions can be a little bit alarming, a little bit personal for patients. Oftentimes they're worried, are we trying to find reasons to take away their freedoms? In fact, what we're doing is trying to promote their individual goals around care and also get them back to their level of function that they came into us with so that they can maintain their freedoms and maintain their independence at home. The Geriatric Surgical Program at Rochester Regional Health has created a new level of care, a new standard of care. In doing so, we've made sure that those processes exist whether a patient chooses to enroll or not. It's a new standard of care that we provide, and so you don't have to seek out a surgeon at Unity, Newark, or Clifton that participates. All surgeons participate. We look forward to bringing this forward to Rochester General and UMMC and the St. Lawrence Health System in the future, so that no matter where you go in the Rochester Regional Health System, a new standard of care for our geriatric patients exists.